Endometriosis is a common and often painful condition. It affects millions of women worldwide. Understanding this condition is the first step towards seeking proper care and support. In this essay, we will delve into the intricacies of endometriosis, exploring its symptoms, causes, treatments, and broader impact on women's lives. Imagine a condition where tissue similar to the lining of your uterus, called the endometrium, grows outside of it. This is the hallmark of endometriosis. These endometrial-like tissues can attach to the ovaries, fallopian tubes, the outer surface of the uterus, and even other organs in the pelvic area. This misplaced tissue continues to behave like it normally would inside the uterus. It thickens, breaks down, and bleeds with each menstrual cycle. However, unlike the normal menstrual flow, the blood and tissue shed from these implants have nowhere to go. This leads to inflammation, pain, and a range of other symptoms. To fully grasp the complexities of endometriosis, it's essential to understand the role of the endometrial lining within the uterus. The endometrium is a dynamic tissue that undergoes cyclical changes throughout a woman's menstrual cycle. It thickens in preparation for a potential pregnancy, providing a nourishing environment for a fertilized egg to implant. Under the influence of hormones like estrogen and progesterone, the endometrium grows and develops a rich blood supply. If pregnancy doesn't occur, the endometrial lining sheds, resulting in menstrual bleeding. This carefully orchestrated process ensures the uterus is prepared for a potential pregnancy each month. However, in endometriosis, this same tissue, when present outside the uterus, behaves abnormally. The endometrial implants respond to hormonal fluctuations, but are unable to shed and exit the body as they normally would. This trapped tissue leads to a cascade of events causing inflammation, pain, and potential complications. Endometriosis can manifest with a wide range of symptoms, varying in severity. Some women may experience mild discomfort, while others face debilitating pain. Recognizing the signs is crucial for early diagnosis. Pelvic pain is one of the most common symptoms, often described as a deep, aching pain. This pain may be particularly intense during menstruation. It can radiate to the lower back and legs. Painful intercourse is another frequent complaint, often caused by endometrial implants. Women may experience irregular periods, including heavy menstrual bleeding. Some may also have difficulty getting pregnant. The severity of symptoms doesn't always correlate with the extent of the disease. The symptoms of endometriosis can significantly impact a woman's quality of life, affecting her physical, emotional, and social well-being. Chronic pelvic pain can interfere with daily activities, making it challenging to work, exercise, or engage in social events. The unpredictable nature of endometriosis pain can be particularly frustrating, leading to anxiety and stress. Many women with endometriosis find that their symptoms worsen during menstruation. The pain and discomfort can be so severe that it disrupts their ability to attend work or school, participate in hobbies, or maintain relationships. The emotional toll of living with chronic pain should not be underestimated. It can contribute to feelings of isolation, depression, and anxiety. Endometriosis can also strain intimate relationships. Painful intercourse can lead to decreased libido and intimacy issues. The emotional stress of managing a chronic condition can also put a strain on partnerships. It's important for women with endometriosis to communicate openly with their partners about their symptoms and the impact on their lives. Section 5, exploring the causes, a multifaceted puzzle. Despite extensive research, the exact causes of endometriosis remain elusive. Scientists believe that a combination of factors likely contributes to the development and progression of this complex condition. Understanding these potential causes is crucial for developing more effective prevention and treatment strategies. One of the most widely accepted theories is retrograde menstruation. This theory proposes that during menstruation, some of the menstrual blood flows backward through the fallopian tubes and into the pelvic cavity. These endometrial cells, instead of being expelled from the body, may implant and grow on the surfaces of organs in the pelvis. Other potential contributing factors include genetic predisposition, immune system dysfunction, and environmental factors. Women with a family history of endometriosis are at increased risk, suggesting a genetic component. Immune system disorders may impair the body's ability to recognize and clear endometrial cells outside the uterus. Environmental factors such as exposure to certain chemicals are also being investigated for their potential role. Diagnosing endometriosis. A journey to understanding. Diagnosing endometriosis can be challenging as its symptoms often overlap with other conditions. There is no single test to definitively diagnose endometriosis. The journey involves medical history, physical exams, and imaging tests. A pelvic exam is usually the first step. Imaging tests like ultrasound or MRI provide detailed views. Laparoscopy is the gold standard for diagnosing endometriosis. It allows direct visualization of pelvic organs. Section 7. Managing endometriosis medical treatment options. While there is no cure for endometriosis, various treatment options can help manage the symptoms and improve quality of life. The most appropriate treatment approach depends on the severity of symptoms, the woman's age, and her desire for future fertility. Treatment plans are often individualized and may involve a combination of approaches. Pain management is a primary focus in treating endometriosis. Over-the-counter pain relievers, such as ibuprofen or naproxen, can be effective for mild pain. For more severe pain, prescription pain medications may be necessary. Hormonal therapies, such as birth control pills, patches, or rings, can help regulate hormone levels and reduce endometrial tissue growth. Gonadotropin-releasing hormone, GnRH, agonists are another class of medications used to treat endometriosis. These medications work by blocking the production of estrogen, which can shrink endometrial implants and reduce pain. However, GnRH agonists can cause side effects, such as hot flashes and bone loss, so they are typically used for short-term treatment. Section 8. Surgical interventions addressing endometriosis. In some cases, surgery may be recommended to remove endometrial implants or adhesions, which are bands of scar tissue. Surgical interventions aim to relieve pain, improve fertility, and address any complications caused by endometriosis. The type of surgery performed depends on the location and extent of the disease, as well as the woman's individual circumstances. Conservative surgery aims to remove or destroy endometrial implants while preserving the reproductive organs. This type of surgery is often performed laparoscopically and may involve using lasers, heat, or electrical current to treat the implants. Conservative surgery can be effective in relieving pain and improving fertility in many women. Hysterectomy, the surgical removal of the uterus, is typically reserved for women with severe endometriosis who have completed their families or do not desire future fertility. While hysterectomy can eliminate menstrual periods and uterine-related pain, it's essential to note that it does not always eliminate all endometriosis symptoms. Section 9. The broader impact, quality of life, and associated conditions. Living with endometriosis can have a profound impact on a woman's overall well-being, affecting her physical health, emotional well-being, social life, and career aspirations. The chronic pain, fatigue, and other symptoms can make it challenging to maintain a normal lifestyle, leading to feelings of isolation and frustration. Beyond the physical symptoms, endometriosis can take a toll on mental health. The unpredictable nature of the disease, coupled with the challenges of diagnosis and treatment, can contribute to anxiety, depression, and relationship difficulties. It's crucial for women with endometriosis to have access to mental health support to help them cope with the emotional aspects of the condition. Furthermore, emerging research suggests a potential link between endometriosis and other health conditions. Studies have shown an increased risk of certain autoimmune diseases, such as lupus and rheumatoid arthritis, in women with endometriosis. Additionally, some studies suggest a possible association with certain types of cancer, although more research is needed to confirm these findings. Section 10. Raising awareness and advancing research. Endometriosis affects millions of women worldwide, yet it often remains underdiagnosed and misunderstood. Raising awareness is crucial for early diagnosis, better treatment, and support. Continued research is vital to uncovering causes and developing therapies. Increased awareness empowers women to seek medical attention and support. Sharing stories helps break down the stigma of this illness. Public education campaigns are vital for educating about endometriosis. Scientists are working to understand causes and develop treatments. Clinical trials evaluate new medications and surgical techniques. Ongoing research offers hope for better outcomes and a brighter future.